Good afternoon, everyone. Welcome to LUMP TCM 101 webinars. Let's start the ball rolling with blood. Let's welcome certified acupuncturist from Apaya, Ma'am Mildred Digma. Good afternoon, Ma'am Mildred.
Good afternoon po sa lahat. Good afternoon, classmates. So, ang topic po natin muli ay ang blood. Causes of blood deficiency. Diet and eating habits. So, to produce blood, you need to eat blood-building foods. Many vegan, vegetarian, or low-fat diets lack blood-building foods and are supplemented fully. So, overconsumption of meats inhibits spleen function. Restrictive diets and fasting deplete us of food. Damp or cold foods inhibit spleen transformation function. So yun po. When we consume too many damp or cold foods, tulad po niya, no, yung ice cream, mga damp food po yan. It's like throwing wet leaves on the digestive fire. So it slow down and clog up spleen. As a result, spleen produces less blood. Parang nahaharangan po yung yung function niya, humihina, bumabagal kasi may mga cold na pumapasok. So yun po yung ginagawa pag kumakain tayo ng mga damp or cold foods, pinapahina ng spleen chi. Pag mahina ng spleen chi, konti rin ang magagawa niyang blood. So yan po yung How we eat affects quality of our blood. So kung kumakain tayo ng marami, uso ngayon yung eat all you can, naapektuhan po yung ating spleen. Ganon din po yung eating too quickly. Nagmamadali ka kasi papasok or may gagawin. Hindi mo na nadadigest maigi. So hindi makukuha ng maayos yung nutrients ng ating bituka. Then irregular eating, kung kailan mo lang gusto kumain, once a day. So konti yung mapuproduce na blood. Eating on the run, eating while working, or eating before bed, impair spleen ability to transform and make blood. Yun nga po, pinapaalala natin dahil sa panahon ngayon, lagi nating kaharap ang ating mga gadgets, ang mga laptops. I-discipline po natin yung katawan na pag kumakain, concentrate lang sa pagkain para hindi maapektuhan yung ating spleen. Yung energy po ng spleen nakakoncentrate din dun sa pagdadigest ng ating pagkain. Hindi inaagaw pa ng ating utak. Okay. So, ganun din po kung may mga worry. Kasi ito yung emotion na nag-a-apekto sa energy ng spleen stomach. Anxiety and overthinking. Kaya nga kung kumakain po tayo, bawal din doon ka nanenermon sa lamesa. Kasi yung galit na, may galit dun sa iba, doon tapos yung kaharap mo, naiinis, nag-iisip na, yun, naapektuhan po yung function ng spleen. So, spleen was affected by worry, overthinking, and anxiety. Constant multitasking. Yung sa dami ng gusto mong gawin, sabay-sabay. Nahirapan din po yung ating mind at ina-affect niya yung energy ng chi ng spleen stomach. Detailed mental work, office or school work, lingering worries. O ngayon pong panahon ngayon, ang daming alalahanin ng buhay. Anxiety or psychological traumas. Or all in fact, spleen ability to transform food into blood. So kung marami po tayong iniisip, inaalala, hindi po nagagawa ni spleen ang maayos na pagdadigest kahit marami kang kinain, hindi niya na madadigest para maging blood. So these states can lead to poor appetite, further complicating the cycles. Pwedeng mawalan ka ng gana or kain ka ng kain, ganadong-ganado ka, pero hindi nagiging blood dahil hindi ma-digest ng maayos ni spleen. Ito yung picture natin. Ganun din po yung excessive work. So, physical and mental works consumes chi and blood. Habang gumagalaw po tayo, nag-iisip, ang ginagamit po ng katawan natin, yung ating dugo, yung ating enerhiya. When we rest, liver stores blood and send out when we need it. So kung nagre-rest po tayo, nakakapag-store uli yung ating liver. At pag gumalaw tayo uli, yon, gagana na naman, magagamit na naman natin yung chi and blood na galing dun sa food na kinain natin. So when blood is deficient and we're pushing ourselves, diba, kulang na nga lang yung dugo mo, pero gusto mo pa rin trabaho ng trabaho, we are using up the reserve. Ibig sabihin, yung reserve na po ng katawan natin yung ginagamit mo. So, ang mararamdaman po ninyo, magkakaroon ng muscle and tendons do not get nourished. Magkakaroon ng numbness, frequent sprain, body ache, fatigue, at saka more vulnerable to injury. Kasi weak na yung kulang na lang yung dugo. Sinasaid mo yung energy, yung blood dun sa iyong system sa katawan. So kung pagod po, need talagang magpahinga na. Okay? Kung mayroon namang blood loss or trauma, halimbawa mayroong heavy menstruation, then yun yung nanganganak. Ang nanganganak po, karaniwan talaga maraming nilalabas na dugo. Nagkakaroon ng internal bleeding kasi pwedeng may karamdaman na, no? Blood loss through physical trauma, halimbawa na aksidente, yun maraming lumabas na dugo. So, holding in emotions. So, ang responsible po sa emotion is liver. Liver also responsible for supplying qi to spleen. Siya po yung nagpapadala ng qi para mag-digest ng ating spleen stomach ng mga food na kinain. Liver is susceptible to anger and tends to stagnate when our expression is black. Ngayon, kung lagi kang nagagalit, hindi magagawa ni spleen. Ni liver yung pagpapadala niya ng qi sa spleen. So magkakaroon po ng stagnation. So when liver is stuck and cannot support spleen, magkakaroon po ng blood deficiency. Kaya minsan kahit kumain ka ng maayos pero lagi kang nagagalit, nagiging payat ka pa rin kasi kulang nga yung napoproduce na blood ni spleen. Ganon din po kung mayroon ng excess drinking or drug use. So yung pag-inom ng mga hard liquor, excess drinking or drug use weakens ability to liver to store blood and create dump in the spleen. Ayun po. Yung mga drug use po, lalo pa mga hindi naman nireseta ng doktor o yung mga bawal na gamot, yun po, na-affectan po yung ating liver. Thank you for your attention.
Thank you very much, Ma'am Mildred. Up next is discussion of body fluids. Let's listen to Ma'am Teresita Sumile of Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector, and good afternoon to everyone. Yin deficiency and stomach heat on the tongue. That yin deficiency can occur without empty heat is demonstrated by tongue diagnosis, as many patients have a tongue and lacks a coating, indicating yin deficiency, but is not red. So the first picture from the left, this tongue partially lacks a coating and the other coating is fruitless. So it indicates yin deficiency and has a normal color, so it has no empty heat. And the middle tongue, this picture, this tongue lacks a coating, so it indicates yin deficiency. And since it has a normal color, so there is no empty heat. Then the third one, the tongue lacks a coating, so it indicates yin deficiency. And since it is slightly red in the center, so this is the beginning of stomach empty heat. Next, on the left, this tongue lacks a coating and has cracks, so it indicates yin deficiency and is of a normal color, so there is no empty heat. However, it is slightly redder on the front third, indicating mild empty heat in the lungs, okay? And the tongue picture on the right, this tongue lacks a coating, so it indicates yin deficiency. And it is red, so there is no empty heat. However, it is also purple, so it indicates blood stasis. At ito naman, this tongue lacks a coating, so it is yin deficiency. And since it is red, so it indicates yin deficiency with empty heat. Now, in yin deficiency, the tongue body color is pale and has no coating. I'm sorry, pale red and has no coating. In yin deficiency with empty heat, the tongue body color is red with no coating. Now, when the tongue is red with no coating, it indicates full heat, while a red tongue without coating, it indicates empty heat. Yin deficiency and empty heat are not formed in a short space of time. It takes years from them to develop. The tongue shows clearly not only the present condition, but also the stage it is at. It therefore also shows where it is developing from and what it may lead to. The three stages of the formation of yin deficiency are rootless coating. This is the mildest form of yin deficiency. Coating partially peeled and coating missing completely. Empty heat may develop at any of these stages, but it is more likely to develop at the third. So this tongue has no coating, but the body color is normal. So it is yin deficiency. And this tongue on the right has no coating with redder body, so it is yin deficiency with slight empty heat. Okay. Now, the first tongue picture below, the tongue is red with coating, so it indicates full heat. And the last three tongue pictures are a manifestations of empty heat because the tongue is red without coating. Okay. Deficiency of stomach yin with stomach empty heat. There is no coating in the center and the tongue body color is red. Degrees of yin deficiency. Yin deficiency is a gradual process which develops over years. The absence of coating in a tongue with a normal body color indicates fairly advanced yin deficiency, but without empty heat, the following slides are illustrations of varying degrees of yin deficiency. The first tongue picture, the tongue has coating missing entirely, then the color is normal, so indicates stomach yin deficiency and no empty heat. Note that the tongue is also swollen, so therefore there is phlegm. Okay, and the tongue on the right, tongue picture on the right, it has the coating entirely missing, slightly red body, so it indicates deficiency of yin of stomach and possibly kidneys with some empty heat. The widespread presence of cracks indicates a deeper stage of yin deficiency. Okay? And the third picture on the left, the coating is entirely missing and the tongue body color is red. So it indicates yin deficiency of stomach and possibly kidneys with empty heat. The presence of a hard crack also leads us to deduce that there is possibly also hard yin deficiency. Then the picture on the right, this shows entirely without coating everywhere. So it indicates deficiency of yin of stomach and kidneys. As the tongue is also deep red, there is intense empty heat. This is very severe yin deficiency and this patient had liver cancer. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Up next is Yin and Yang. Let's listen to Ma'am Needs You, certified acupuncturist from Silang, Cavite. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, classmates and everyone. So, topic for today is Yin and Yang relationships. Okay. This is a picture of Yin and Yang in absolute balance in every organ, every cell of the body. This almost never occurs except during a transitory stage. Yin and Yang are ever changing their state, always relating to each other, thus changing the state of the organs in the body as well. Okay? Pareho sila. In the morning, after sleep and a good breakfast, our energy state may be like this, magkapantay. But then we start to work or to be active and our yang increases to create functional energy. The blood in yin decrease as they give up the stored nutrients to fuel the functional energy. At the end of 4 hours of work, our yin and blood decrease according to use and we feel tired, hungry, and thirsty. After eating naman a big lunch and dessert, we are too full of food or yin to go on being active and feel lethargic, sleepy, and lazy. Okay. Okay. A disease is an imbalance between the yin and yang. The normal imbalances in every living, hunger, tiredness, fullness after eating, excitement, are quickly balanced by eating, resting, or exercising. But imbalances of disease do not get corrected that easily. They are more prolonged and they need to be corrected with treatment, diet, and change in lifestyle. For example, a patient with hyperthyroid function is often hungry, hot, sweaty, and tired. But this does not improve with eating or rest. This imbalance is that of a disease. Therefore, treatment of the disease would be to balance the energies. This can be performed by acupuncture, diet, and herbal medicine taken internally, exercise, relaxation, and a change in lifestyle. Remember po. Okay? Therefore, in Chinese medicine, the diagnosis of a disease means to find the imbalance in the relevant organs or in the body. The treatment, therefore, is the balancing of this state back to normal. Okay? Ito yung 8 imbalance states of yin and yang, principle of energy balance. Sa acute stage, yun yung 1 to 30 days, there is excess of energy, needs sedation. Okay? Sa chronic stage naman, 6 months or over, there is deficiency of energy. It needs to be tonified. Okay? Pareho po siya na may imbalance. Sa subacute naman, 1 to 6 months or recurrent states, there is excess and deficiency. It is to be sedated and tonified. Sample po niya yung hyperactive or hypersensitive yang sa tower diagram na nakikita nyo sa left and then sa right, yung stagnation or retention of yin. Understand na lang po yung tower diagram. Okay? Sa energy imbalances result in disease. Disease states classified into acute, chronic, and subacute or recurrent states. Example, pain with yang dominant nature. Yan po yung sharp, severe, pulsating, radiating pain, worse during activity, or due to other yang causes. It means that imbalance causing the pain is a yang dominant state. There are 3 yang dominant states. Yung yang excess, yung tower diagram, yung deficiency and yung excess, and the yin deficiency. Please understand the tower diagram, which is yin and which is yang. Okay? Deficient and excess. So how do we decide which of these three yang dominant states our patient is in? So we have to question them. Okay? There are three basic questions. Number one, where is your pain? Nasaan yung pain mo? The answer would point to a meridian or organ we should be treating or balancing. So, pag tinuro niya kung nasaan yung pain, madidetect na natin kung anong meridian o anong organ ba yung kailangan nating i-treat para mag-balance. Okay? So, number two, describe your pain. How is the pain? When do you have pain? Worsens with what? Ano yung nakakalala? Kapag pag nag-i-improve naman, ano yung nakaka-improve? This gives idea if this was yin or yang dominant problem. Okay? The number three question, how long have you been having this pain? The answer would help us to decide if we have acute pain or the excess state, or chronic disease, the deficiency state, or subacute or recurrent diseases, which is either excess or deficiency. Excess and deficient po. Okay? So once we have made this diagnosis, we would balance organ or meridian by sedating or reducing yang in the first case. Pipili po tayo. Tonifying or increasing yin and sedating yang in the second imbalance. And tonifying yin only in the third case. Okay? As all diseases of yang nature are caused by imbalance in energy, where yang is dominant to yin. This does not automatically mean that yang is in excess or that yin is less than normal energy level. Okay? Whether there is an excess or deficiency compared with normal level, it has to be decided by the fact if it is acute or chronic. Remember, okay? If the disease state is new, this is considered to be excess state, which is called acute states from now on. Remember po pagka bago pa lang, excess state. Okay? There is excess of yang in a yang disease, so excess of yin in a yin disease. Okay. The three diagrams below show three possibilities in acute and or excess situation. Yan, yung yang excess, number 1, 2, yin excess, and 3, yin and or yang excess. Okay? Pili po. A disease state which has been going on or gradually worsening for less than 6 months is chronic state. More than 6 months is chronic state, where considerable amount of energy has been consumed. Therefore, a deficiency state, yin deficiency in yang disease or yang dominant to yin, yang deficiency in yin disease or yin deficiency of both yin and yang would produce both yin and yang symptoms. Ano yung symptoms na yon? Pain worsening with rest and activity, asthma during hot and cold weather. So, ayan po yung tower diagram ng yin deficiency, yang deficiency, yin and yang deficiency. Okay? In transition between acute and chronic states, there is intermediate subacute state where the excess side consumes opposite side. Then this causes deficiency in that state. Okay? Example, high fever could cause dryness, or extreme humid weather can cause sluggish blood and fluid circulation. This resulting states would look similar to this. Okay? Hyperactive yang, hypertensive yang. Yan po yung tower diagram. And yin stagnation and yin retention. Please study the tower diagram. Okay? Thank you very much, everyone.
Thank you very much, Ma'am Needs. Up next is the 5 elements. Let's listen to Sir Dino Pinero from Legazpi. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay. Punta na po tayo sa 5 elements. Whose cycle, insulting cycle. The counter action or counter control of the 5 elements. One element of the 5 counteract on its controlling element. The sequence of counteraction: wood counteracts on metal, metal on fire, fire on water, water on earth, earth on wood. So we have here yung diagram, yung mga arrows, susundan lang po. Wood should be controlled by metal. Okay? If wood is especially strong, it will not only fail to be controlled by metal, but it counters act on metal. Wood counteracts on metal. So, ito po yung arrow. If metal is quite weak, it will not only fail to control wood, but will be counteracted by wood. Metal is counteracted by wood when it is weak. So, ito po yung arrow. Differences and relationship between overaction, overcontrol, and counteraction. Sa overaction, excessive action as part of sequence of interaction among 5 elements. Abnormality in action of promotion and restriction among 5 elements. Yung counteraction naman, restriction in form of reverse sequence of interaction among 5 elements. Abnormality in action of promotion and restriction among 5 elements. Counteraction may happen at the same time when over-control presence and vice versa. If wood is overstrong, it may not only overact on earth, but also counteract on metal. If metal is deficient naman, it may not only be counteracted by wood, but also be overcontrolled by fire. So, dito po yung illustration, yung wood sa Shen cycle, creation cycle sa fire. Tapos, sa overacting cycle, yung Cheng, yung earth to fire. Yung insulting cycle, Wu, sa wood to earth, destruction cycle, okay, earth to wood. And same with the others. Okay po. Sa insulting sequence pattern, yung wood insulting metal, metal insulting fire, fire insulting water, water insulting earth, and earth insulting wood. Sa wood insulting metal, the clinical manifestation are cough, asthma, and a feeling of distension of chest and hypochondrium. So we have here another picture, yung liver channel influences the chest, and stagnant liver qi or liver fire can obstruct the chest and prevent lung qi from descending. Liver qi stagnation is one of the most common TCM patterns. It has many causes such as suppressed or overexpressed anger, resentment, and frustration. A diet rich in stimulants, drugs, fatty and oily foods, or overwork without sufficient rest. So, ang pulse type is wiry or cyan. Yung tongue color, normal or light red. Sa common symptoms, there is feeling of distension in the hypochondrium or sa chest, epigastrium, or abdomen. Meron siyang mood swing, depression, frequent sighing, merong painful and irregular periods, and breast distension. Dito, we have the liver fire. Ang symptoms, there is temporal headache, worse on stress, meron siyang red eyes and face, very angry, merong tinnitus, high pitch, merong constipation, feeling hot, red tongue, redder sides with yellow coat, and wiry rapid pulse. So we could use yung acupoints liver 2, liver 3, GB34, GB43, and kidney 1. Ang diet, there should be kung meron dandelion, rhubarb, spinach, cucumber, beet, alfalfa sprout, leafy greens, celery, prune, pear, peach, walnut, and seaweed. Sa tips, avoid stress, alcohol, coffee, lamb, or spicy or rich food. So thank you for listening.
Thank you very much, Sir Dino. Up next is types of chi. Let's listen once again to Ma'am Teresita Sumile. She will talk about chi pathologies. Good afternoon po ulit.
Good afternoon ulit, Dr. Hector, at sa lahat na po. Chi pathologies are chi deficiency, chi stagnation, rebellious chi, and chi sinking. It includes, yun na. Next po. Symptoms of and general signs of chi deficiency correlate with chi deficiency in lungs and spleen. Now, chi deficiency always involves the spleen and the lungs. So, in spleen chi deficiency, symptoms are loose stools, fatigue, bloated after meals. And in spleen yang deficiency, symptoms are cold body and limbs and digested foods in stools. Then, in spleen and lung chi deficiency, symptoms are weak cough, fatigue, easily catch colds, weak voice, shortness of breath, asthma, sleep apnea, and environmental allergies. In lung chi, in heart chi deficiency, symptoms are palpitations, sweating when nervous, and anxiety. In kidney chi deficiency, there is incontinence, frequent urination, and chronic low back pain. Okay, in lung chi deficiency, yan na. Tapos na pa. Okay, next. Faint, frail voice. This is deficient lung chi, meaning too weak to stimulate vocal cords. So lack of activity, aversion to move. This function of movement is restricted. Then propensity to catching colds. In lung chi deficiency, production of defense chi is restricted. There is spontaneous perspiration during the day, meaning in chi deficiency, the pores are not closed sufficiently. In slight shortness of breath or dyspnea, this means that lung chi deficiency, the inhalation is weakened. Lack or loss of appetite. This means spleen needs chi to be able to transform food. And fatigue. Chi is expression of our vitality and strength. Chi deficiency manifests in fatigue. Now let's go to chi stagnation. Chi stagnation restricts chi's moving function so that chi cannot move within the body. Qi is warm, and qi stagnation can cause heat. So qi moves blood. In qi stagnation can cause blood stagnation. Qi stagnation, organs affected in qi stagnations are the liver, heart, and the lungs. Now let's go to rebellious qi. Rebellious qi flows contrary to physiological flow of qi. Stomach qi flows normally from top to toe. And stomach functions in Chinese medicines are ripens food and controls digestion with the spleen. Stomach is the origin of fluids. It manifests on the lips and opens in the mouth. Spleen qi direction is going downward. Stomach qi direction moves downward, while spleen qi moves upward. So stomach is greatly affected with heat and dryness. So when there is heat and dryness, stomach qi rebels and gets excess more. When spleen qi is affected with cold and damp, the spleen sinks and gets deficiency more. Okay. Rebellious qi. With rebellious qi, stomach qi, the physiological qi flows inverse and the qi flows from toe to top. It can concern different organs like stomach, spleen, lungs, and liver. Rebellious stomach qi has its own pattern. Organ is the stomach, then normal qi direction downwards, pathological qi direction upwards. Symptoms and signs are belching, hiccup, nausea, and vomiting. Now let's go to qi sinking. Qi sinking is a sub-pattern of qi deficiency, which has all the symptoms of qi deficiency. Okay? Qi is not able to hold the organs in its place. Organ prolapse is the result. And in spleen sinking, spleen is the most involved organ. Thank you so much for watching.
Thank you very much, Ma'am Teresita Sumile. We now proceed to Zangfu organs. Let's listen once again to Ma'am Neets Yu, certified acupuncturist from Silang, Cavite. She will talk about spleen relationships.
Good afternoon again, Doc Hector, and good afternoon, everyone. Spleen relationships po, topic natin. Spleen and the relationship with the large intestine. Large intestine can be functionally assigned to spleen because it depends on a well-working transformation of food in the spleen. Okay? If the spleen function is weak, patterns of large intestine can manifest. Okay? Spleen and heart. Spleen produces food qi, which is the basis of qi and blood production. Heart governs blood and requires qi for this function. Weak production of food qi weakens blood and qi of heart. Okay? Let's go to the spleen and the liver. Spleen produces food qi, which is the basis of food production. Liver stores blood. Weak spleen and insufficient blood production affects the liver blood. Okay? Liver governs harmonious flow of qi. If energy and emotions flow freely, harmonious digestion can happen. Spleen is able to fulfill its function of transformation and transportation. Okay? So, if liver's pre-coursing action is impaired, resulting depression of the liver qi, it affects the digestive function. Liver attacks the spleen. Yan po yung drawing. Okay? Spleen and the liver ulit. Dampness of the spleen affects the liver function and hinders free and harmonious flow of qi. Okay? Spleen dampness. Let's go to spleen and lungs. Spleen produces food qi from food that we ingest. Spleen sends food qi to the lungs. In the lungs, gathering qi and true qi are produced, using oxygen of the air. It is viewed as cosmic energy. Okay, yun po yung transformation. And then the lung depends on high quality of food qi. If spleen is too weak to produce enough food qi, lungs are not able to produce enough true qi. Okay? If spleen produces dampness, dampness is sent to lungs and accumulates. Spleen requires lung qi in order to carry out its functions of transformation and transportation. Okay? Let's go to spleen and stomach. Spleen and stomach stand in interior-exterior relationship. Physiologically, spleen governs transportation and transformation, TNT, and stomach governs the intake. Okay? Stomach and spleen complement and counterbalance each other. Although stomach disorders have to be differentiated from spleen disorders diagnostically, it is often seen in daily practice that the disorder of either spleen or stomach affect the partner organ as well. Okay? Let's go to spleen and kidney. Kidney is source of prenatal qi. Spleen is the source of postnatal qi. Postnatal qi of spleen is required and used by body and spirit. Sorry, nabubulol. Let's go. Okay. Spleen and kidney. Surplus of postnatal qi is sent to kidneys in order to replenish prenatal qi. If spleen is weakened, prenatal qi of kidneys will be affected. Okay. Kidney yang is motor force in digestive process. Insufficiency of kidney yang leads to impairment of digestive function, and spleen is unable to fulfill its TNT function, transformation and transportation. Okay. Let's go to spleen pathology. Okay. Deficiency patterns, yung spleen qi deficiency, spleen yang deficiency, spleen qi sinking, spleen not controlling the blood. Sa excess patterns man, yun yung damp heat in the spleen, damp cold in the spleen. Okay. Thank you very much for your attention, everyone.
Thank you very much, Ma'am Needs. Up next is Meridian Theory. Let's listen once again to Sir Dino Pinero from Legazpi. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Again, our next is Meridian Theory, Yang Main Large Intestine Channel, Part 2. Okay. Nodules generally hard, yung movable and tender, between LI7 and LI10 are often noticeable when there is colitis or polyps in the large intestine. The area between LI7 and LI10 may also present with a line of nodules in chronic drought conditions. So, check po natin LI7 to LI10. This can be understood by thinking of the Yang Min channel as reflective of not just the stomach and intestine, but also other aspects of the entire GI tract and the areas nearby. In this case, the throat is passing right alongside the upper aspect of the esophagus. So dito po sa illustration, check natin LI7 hanggang LI10. Okay po. If there is pain with pressure and some swelling at LI10, this often indicates an acute intestinal inflammation. Often in yang Ming deficiency cases, there will be softness or even drop in the fascia around the point and along the surrounding channel. Deficiency palpated along the channel in this area may be accompanied by an aching at LI10 that is relieved by pressure. Chronic large intestine deficiency is associated with malabsorption, and or chronic low-grade intestinal inflammation. Harder nodules may also be found in the presence of constipation or physical changes in the organ. LI11 will often have a soft, tender nodule in the presence of an external condition. Acute large intestine inflammation may also correspond with tenderness in this area. The area between LI10 and LI11 may also have tenderness or shallow nodules when there is a problems with upper digestive tract. Note that this is an area below the upper esophagus and throat. Clinical experience has shown that as one moves proximally along the large intestine channel, conditions farther and farther down the GI tract begins to manifest. In other words, while the area between LI7 and LI10 often reflects problem in the throat or nearby upper esophagus, the area around LI11 tends to reflect more of the lower esophagus. So we have here an illustration sa LI5 ulit. Yung large pulse, we have external condition, deep, small pulse, strong, excess type, constipation. Pag weak naman, deficiency type. Pag there is softness and weakness, we have cold type chronic diarrhea. LI7, LI10, pag ang nodules, large intestine polyps or colitis, or may indicate chronic throat, trachea, esophagus inflammation. LI11, pag soft nodules, there could be an external condition, intestinal inflammation. Sa LI10 to LI11, if napalpate, there is presence of hardness, there could be a chronic upper GI condition. Pag shallow nodules, there could be acute upper GI or throat inflammation. Sa LI10, hard nodules could be a chronic LI condition, may have changes in LI organ. If there's pain, there could be acute intestinal inflammation and presence of softness and weakness. There could be a generalized yang Ming LI organ deficiency. Pag sa LI4 to LI6, pag hardness ang napalpate, there could be a chronic blood stasis, problem and phase like stroke and paralysis. Pag shallow nodules, there could be acute Bell's palsy, yang Ming facial inflammation, or tooth pain. Okay po. So thank you po for your attention.
Thank you very much, Sir Dino. We now come to the last topic, breathlessness, and we will continue discussing the pathology. So in very chronic cases in old people, the heart may also be involved in two ways. First of all, the heart vessels fill the lungs and the lung chi moves blood. So if lung chi is deficient, blood is not moved and it stagnates in the lungs. This leads to right heart failure due to retention of fluids in the lungs. Second, kidney yang is the basis for heart yang. So when you have kidney yang deficiency, the fire of the gate of life, Mingmen, fails to warm the heart. So that means fluids are not transformed and they accumulate in the lungs and heart. This is manifested with profuse expectoration of white, watery, dilute, and frothy sputum. There will also be pronounced feeling of oppression of the chest and palpitations. So it is called kidney yang deficient with water overflowing to lungs and heart. In even more chronic cases, the deficient heart yang fails to move blood in the chest, and the stagnant fluids in the chest further obstruct blood. So there will be blood stasis in the chest and symptoms of chest pain, cyanotic lips, dark nails, and a purple tongue. So we can summarize the etiology and pathology of chronic breathlessness with this diagram. So let's start from, let us try to understand why a lot of people, especially elderly, will develop chronic asthma, no? So this is something that every practitioner, every serious practitioner should be aware of, okay, so that we can properly manage our patients. And of course, we don't want to see ourselves suffering from chronic asthma when we grow old, diba? So first, as you can see, emotional problems can actually give you liver yang or liver fire. And if you have liver yang or liver fire, this will definitely rebel toward the lungs, no? Because there's too much ascending. So that means the lung chi will not descend, no? So there will be breathlessness. So there will be chronic asthma. Another is the diet. So ngayon pa lang dapat medyo baguhin na natin yung diet natin. So definitely if you have a deficient spleen, you will have phlegm and this will obstruct the lungs, leading to chronic asthma. Overwork, fatigue, kaya dapat we should also remember that we are only humans, we're not machines, we're not AIs. Okay. And also excess sex and the constitution, fatigue. So all of this will lead to kidney deficiency. And we all know that if your kidneys are weak, the chi cannot be anchored. So the kidney, we have here a situation in which the kidney doesn't hold the chi. So you will have chronic asthma, no? And another thing, if you have emotional problems, no? Grabe ang emotions, no? We have learned that this can actually dissipate the chi. So you will have lung chi deficiency. So if you have, and also, when you, let's say, you would like to transfer to another area, and then it happens that you live in a place where the climate is very unkind, so you will have invasion of exterior wind, and you happen to have lung chi deficiency, so you will affect the descending of the lung chi. Then again, you'll have chronic asthma. So dapat isip-isipin natin kung saan tayo magiging expat. You have to really analyze or maybe get acquainted with the place where you would like to spend the rest of your life. No, yon. Okay, so another is when you have already heart issues. So you have your two situations in which you have heart chi deficiency and heart blood stagnation. No, a lot of people don't realize na mahina na yung heart chi nila. So they wouldn't usually go to the doctor, and they still keep on doing the things that they love doing without realizing na everything now comes with an effort, no? So if you have heart chi deficiency, you will have this will definitely lead to chronic asthma, because we all know that if the heart chi and the lung chi, they work together, no? Pag may problema yung heart chi, nagkakaproblema din yung lung chi. Okay? So we see that the chi is not transforming water. Okay? Now, when you have heart blood stasis or heart blood stagnation, definitely medyo cyanotic na yung ano mo, you probably have you should be seeing a cardiologist already. So obviously when you have heart blood stagnation, the chi is not moving blood, and so magkakaroon ka rin ng chronic asthma. So I hope this is something that will benefit everyone, no? So let's summarize the pathology of breathlessness. So the causes of breathlessness center on the lungs, spleen, and kidneys primarily. So if you're a good practitioner, you would know where to focus on. In breathlessness, lung chi fails to descend. In chronic breathlessness, difficulty inhaling indicates kidney deficiency. A deficiency of spleen will lead to phlegm formation, and phlegm, we all know, can obstruct the descending of lung chi. Liver yang or liver fire rising, so bawal po ang magaling. This can impair the descending of lung chi, and this will lead to chronic breathlessness. If lung chi is deficient, so yung mga boses dyan na medyo mahina, na mamaos, and then malamig yung kamay, so blood is not moved, and it will stagnate in the lungs. So pag nag-stagnate po ang blood in the lungs, you will have right heart failure due to retention of fluid in the lungs, no? So we are probably going to discuss this when we touch on anatomy and physiology. And we would like to take this up in conjunction with the cases that you see in the actual cases that you see in hospitals. So when you have kidney yang deficiency, the heart yang also becomes deficient. So that means fluids are not transformed, and this will accumulate in the lungs and heart. Thank you very much for your time. We hope you had a great time with us and hope to see you in our next webinar. Thank you very much.